welcome to Black Friday with Brittany Kennedy. Today is April 10th, 2020, and today I'm going to focus on coronavirus because it is killing us big time. And it's not just attacking everybody, it really is. But the Black community is really hitting us very hard. So, for those of you that are new to Black Friday, this is a space where I like to talk about socio-economic issues in the Black community that we really don't like to talk about. And one of those things happens to be health. So, we're talking about that here. Last week I posted a video titled, "What 7 Deadly Diseases Kill Blacks More Than Any Other Race?" And this week I was paying attention to the news and what's going on, and it is actually affecting Black people more than any other race. So, really what's going on is that the 7 deadly diseases that affect us more than any other race are actually the same deadly diseases that make us more susceptible to the coronavirus. Those are diabetes, asthma, lung scarring, lung cancer, strokes, high blood pressure, and cancer. It affects us a lot more than any other race. Today I'm going to focus on diabetes. 60% more common in Blacks than whites. We are 2 times the risk than whites to get diabetes. Blacks with diabetes have more serious complications than whites. Loss of vision, loss of limbs, kidney failure. According to Maudine Nelson, RD, certified diabetes educator at Naomi Berry Diabetes Center at Columbia University. Why is this? Why is diabetes affecting us more than any other race? Access to healthcare. Lack of patients' efforts to manage blood sugar levels. What's up with that? If you know you have diabetes, then you should be taking care of your body. You should be eating properly and not putting things in your body that are going to make your blood sugar levels spike. That, to me, is just kind of common sense. But, hey, not exercising, not eating enough fruits and vegetables, and biological risk factors. The main thing, actually, my lovely people, is obesity. That's what it says. So I'm going to look at a few quotes here that I pulled up from my research. And one of them is from National Institute of Health. The article is titled, "Factors Contributing to Higher Incidence of Diabetes for Black Americans." And let's see here. Obesity is driving these differences, Carnethon says. The findings surprised us because for the past 20 years, there was a narrative that there must be something we haven't found that was causing this higher rate. We now know there is no mystery to these higher rates. Our efforts to control the traditional risk factors can work to reduce the disparities we observe in diabetes incidence. So guys, honestly, we need to work out more. We need to take care of our bodies better. Not eating foods that are going to block our arteries and hurt our bodies. Stay away from fried foods. Of course, occasionally it's completely fine, but living off of fried foods, living off of fast food is not going to be what your body needs. I think a lot of us might have a meat and potatoes kind of diet. That is a complete opposite of my diet. I don't really eat meat, and I'm not big on the starch. But you really got to implement having more vegetables and more fruit. That's going to keep your body healthy naturally. It's going to give you the energy that you need to be able to do what you need to do. Moving on to the next quote here. So actually, I had just pulled up some information from the CDC, and this is what the death rates are for diabetes. In 2017, Black males, died at a rate of 4.6% versus non-Hispanic whites to 24%. Females were at 32.8%, while whites were at 14.5%. That's like the numbers show, double. Also, coronavirus is killing us, guys. It's killing us at a rate higher than any other race right now. And the reason being, like I said, is because those 7 deadly diseases are the ones that make us most susceptible to coronavirus. So, obviously, we've got to do something here. And I found an article yesterday that broke down what the diseases are in relation to death rate of coronavirus. And for pre-existing conditions, cardiovascular disease ranks as number 1. The death rate in confirmed cases, is 13.2%. For diabetes, coming in at number 2, 9.2%. Chronic respiratory disease, 8%. Hypertension, 8.4%. Cancer, 7.8%. All of these illnesses are on the list for the top 7 deadly diseases for Black people. The rate in which we die from these diseases is more than any other race right now. So the fact that coronavirus is killing us more than it's killing anybody else is a no-brainer. And I saw a video today about some kids, or some Black kids, basically. And I say kids, but they were adults, really. They range from different ages, but they were hanging out, and so the police had to come in and outside and try to enforce social distancing. They had no mask on. They had no gloves on. And I'm just sitting there wondering, what's going on in their minds? Are they not realizing that this is an actual serious illness? Or do they think the same things that some people were saying in the beginning? This disease cannot kill Black people. Well, let's be honest, the majority of us really aren't just Black. The majority of us have a little bit of white somewhere in our bloodline. So 9 times out of 10, even if that was a truth, which it's not, it would still actually be killing us. So, this to me is very, very sad and very disconcerting. And the funny thing is that last week when I posted my video, I made in my commentary on the post that I made on Facebook, is coronavirus killing off the Black race? And it was really just an attention grabber to get people's attention, to get them to actually to actually listen to the video. And lo and behold, there was kind of some truth to it. So the Washington Post is where I've gotten this information from. And it says, as the novel coronavirus sweeps across the United States, it appears to be infecting and killing Black Americans at a disproportionately high rate, according to a Washington Post analysis of early data from jurisdictions across the country. The emerging stark racial disparity led the Surgeon General Tuesday to acknowledge in personal terms the increased rates for African American amid growing demands that public health officials release more data on the rates of those who are sick, hospitalized, and dying of a contagion that has killed more than 12,000 people in the United States. And then it goes on to talk about how detailed data on the race of coronavirus patients has been reported publicly in fewer than a dozen states and several more counties. My thought is they really don't want you to know that it's killing Black people the way that it is. I don't know. Racial discrimination, possibly? Anywho, African Americans' higher rates of diabetes, heart disease, and lung disease are well documented, and Louisiana Governor John Bel Edwards noted that those health problems make people more vulnerable to the new respiratory disease. But there never has been a pandemic that brought the disparities so vividly into focus. The crisis is shining a bright light on how unacceptable these disparities are. Fauci said at the briefing, there is nothing we can do about it right now except to try and give African Americans the best possible care to avoid complications. Just to give you an idea, okay, by contrast, Fulton County, which includes Atlanta and has a population of more than 1 million, had had 1,185 cases and 39 deaths. Black residents make up 70% of Doherty's population and more than 90% of coronavirus deaths, said County Coroner Michael Fowler. Historically, when America catches a cold, Black America catches pneumonia, Albany City Commissioner Demetrius Young said last week. Elected officials and public health experts have pointed to generations of discrimination and distrust between Black communities and the healthcare system. African Americans are also more likely to be uninsured and live in communities with inadequate healthcare facilities. As a result, African Americans have historically been disproportionately diagnosed with chronic diseases such as asthma, hypertension, and diabetes, underlying conditions that experts say make COVID-19 more lethal. So, why are we not taking better care of our bodies? I'm just wondering. Now, granted, I'm pretty sure none of us ever thought that we would see a pandemic like this, but it's situations like this where you stop and think to yourselves, damn, I wish I had taken better care of my body. Now, certain things like asthma, there's nothing that we can do about that. That is something that you're born with. But diabetes, yes, some people, it runs in the family, etc., etc. But taking care of your body can also mitigate a lot of these issues. High blood pressure. All these things can truly be mitigated. So we really have to take better care of our body, but we're already here now, right? You're not going to reduce your risk of diabetes in 24 hours to make you less susceptible to getting coronavirus. So at this point in time, it is within our onus to take better care of our bodies at this point in time, to be proactive. So if you have to go outdoors, wear a goddamn mask. Excuse my language, Phoenix. Wear a mask. Put on gloves and buy a mask. You can make these homemade masks, but understand that they are not anywhere near as effective. I understand, Lovey, okay? They're not as near as effective as buying one, as a hospital grade one. It's not going to do the same thing, okay? So you need to be aware of that. I know it's like a trend and everybody's like, make a mask, you can buy a mask. My son just farted. I wonder if that, seriously, Phoenix? I'm not supposed to do that on camera, kid. Anywho. So yeah, wear a mask. If you're going to make one, understand that you're putting yourself at risk still because it's not the same. Wear gloves, keep hand sanitizer, and make sure the hand sanitizer is the grade in which will actually kill the virus. I believe it needs to have at least a minimum of 70% alcohol. Some of the, cheaper hand sanitizers out there are probably not going to do the job. Get Lysol, get Lysol wipes, Lysol spray, everything that you need to keep yourself protected against this virus. Keep your distance from people, even those that you live with. My son, obviously, I have to take care of him. But we're not leaving the house. We have not left the house in 5 weeks now. Literally, not left the house at all. So, do it. His father goes out and gets everything that we need, and it sucks that he is the one who's having to risk his life and his safety, but he's doing the best he can to be safe. He's also an essential worker, so he has to go out there. Do not be just going out there for the leisure. I know it's difficult. I know it may not be the best on your mental health. So you're going to have to make sure that you keep your mind healthy, your spirit healthy as well. This time is a very difficult time. I have a newborn and I'm constantly concerned about what's happening and making sure that I keep my body hydrated, keep my body well taken care of, make sure I eat my vegetables so that he has all of the essential vitamins that he could possibly have on top of the vitamins that he actually takes on a daily basis. So take care of your bodies, guys. This is your vessel. It's your house. If you want to be here, you're going to have to take care of it because it's going to give you the ability to live longer. And I'm pretty sure all of you have something to live for. a child, a mother, a father, a sister, a brother, yourself. I don't think it's all of our time yet. And so we need to be very active about making sure we do what we need to do to stay safe and healthy. This virus knows no color, it hits everybody. But understand that there are certain diseases and illnesses that make us that much more susceptible to this ridiculous illness. So please, guys, stay safe. I want to see my brothers and sisters flourish and thrive in this world. And the only way to do that is to keep us alive, keep our bodies healthy. Okay? So, peace, love you. Thank you for coming and checking out my lovely YouTube channel. Subscribe to my lovely YouTube channel. Share my lovely YouTube channel. I don't know how many times I could say YouTube channel back to back, but thank you guys so much for checking it out. Like it, share it. This information should be passed around your community. You should listen to it, try to heed it. Give your advice, comment. I do respond. Love you. Ciao.